Healthcare costs are a significant part of any retiree's budget. Unfortunately, these expenses are not only unavoidable, but are also increasing at an alarming rate. Many retirees find themselves unprepared for the rising costs, which stress their financial plans and diminish the quality of their golden years. Understanding why these costs are increasing and how to manage them is key to maintaining physical and financial health during retirement. Why healthcare costs are skyrocketing. Several factors contribute to the rapid rise in healthcare costs for retirees. For instance, a doctor's visit that used to cost $100 a few years ago may now cost $150 due to medical inflation. This means that healthcare takes a bigger chunk of your retirement income every year. Inflation in medical services. Everything from doctor visits to hospital stays has become more expensive. Medical inflation consistently outpaces general inflation, meaning healthcare takes a larger chunk of retirement income every year. Prescription drug prices. The cost of medication continues to rise, and many retirees find they need multiple prescriptions to manage chronic conditions like diabetes or heart disease. Limited coverage by Medicare. While Medicare is a lifeline for retirees, it doesn't cover everything. For example, dental, vision, hearing aids, or extended long-term care are generally not included, leaving retirees with gaps in coverage. Higher out-of-pocket costs. Many retirees are surprised by Medicare deductibles, copays, and premiums, which can occasionally feel as high as they did before turning 65. Supplemental plans like Medi.care or Medicare Advantage can help, but they come at an extra cost. The financial impact on retirees. The financial burden of these escalating costs is a significant concern for retirees. Studies indicate that a couple retiring today will expend hundreds of thousands of dollars on healthcare throughout retirement. This figure doesn't even account for unexpected surgeries or sudden illnesses, which can deplete savings. If not adequately budgeted, healthcare expenses can derail even the most well-thought-out retirement plans. Retirees who rely on fixed incomes or Social Security often find themselves cutting back on leisure spending or dipping into savings earmarked for emergencies or family support. Strategies to manage healthcare costs. Though the future of healthcare costs may seem daunting, there are strategies retirees can use to manage these expenses effectively. Understanding Medicare coverage and costs is crucial. Take time to learn what is and isn't covered by Original Medicare, Parts A and B. This knowledge will help you anticipate out-of-pocket costs and budget accordingly. Consider a Medicare Advantage or supplemental plan. Medicare Advantage plans often bundle additional coverage like dental, vision, and prescription drugs. Medi.care plans, on the other hand, help cover things like copays and deductibles not included in Original Medicare. Plan for long-term care. Since Medicare doesn't cover custodial care or extended stays in nursing homes, look into long-term care insurance. This might save you money in the long run if that type of care becomes necessary. Focus on preventive care. Medicare often covers preventive services like annual wellness visits, screenings, and vaccines. Staying ahead of potential health problems can help reduce future medical bills. Budget and save specifically for healthcare. If you qualify, consider creating a separate healthcare savings fund or using tools like a health savings account (HSA) before retirement. Even as a retiree, adjusting your budget to account for rising medical expenses is essential. Shop around for prescriptions. Use Medicare's Plan Finder tool or discount drug programs to find affordable medication options. Many pharmacies and companies offer savings programs to cut prescription costs. Taking control of your healthcare costs. While rising healthcare costs for retirees can be daunting, taking a proactive approach can make a significant difference. Start by educating yourself on Medicare options, understanding your own healthcare needs, and adjusting your financial plans to include these inevitable expenses. Though retirement is a time to relax and enjoy life, staying prepared for healthcare costs will bring you peace of mind and, ultimately, quality of life. Are you confident that your current financial plan can handle the rising cost of healthcare in retirement? Have you explored all available supplemental coverage options, such as Medigap or Medicare Advantage, to minimize out-of-pocket expenses?